Okay. Mostly, to keep it easy for medicine, only ankle is sprain, everything else is sprain. Okay. That's the best way to learn. All right. Okay, this was the page I was reading. Let's go here. There are some common musculoskeletal conditions. Two things, the most high yield here. These two are considered super high yield. Let's start with first Dequarian tenosynovitis. The minute you hear the word Dequarian, what do you remember? It's painful. Where did we come across that word before? Type it up. Where did we come across? Dequarian thyroiditis, isn't it, folks? What is the histology of Dequarian thyroiditis? What is the histology of Dequarian thyroiditis? I asked you guys to highlight it and I said it's high yield. You reviewed endocrine by now, it's 3 times since we started the course. Start with G. Right? Tanuja, you agree? Oh, look at the smart. Granuloma is because G. It is granulomatous inflammation. Okay. It's granulomatous inflammation. Folks, you have to remember, no excuse now. You reviewed endocrine 3 times. Okay. So this is Dequarian tenosynovitis. At that time I mentioned, okay, this is a disease where it's very painful. Non-inflammatory thickening of abductor pollicis longus and extensor pollicis brevis. They ask you the name of the muscle tendon. Okay, they do. These are the 2 tendons. They're showing it here. Now let's talk about this. That's for this thumb. Okay. I've seen literally about 3 or 4 patients in single day when I did orthopedics electives. When I was in clinic, whoever comes with that problem, it's always a single mother carrying the baby in the hand. That's how they come to the clinic. So why is that? When I have a baby, you hold the baby like this, and we use the thumb to give a support to the baby's head, isn't it, folks? So if you keep the thumb in a certain position for a longer time to support the baby's head, it inflames the tendons. Is that clear, folks? It inflames the tendons. That's why it is, okay? Now, if you see, it's a pain or tenderness at the radial styloid. We do a test called Finkelstein test, okay? What does that mean? When the patient comes, we just pull it like this. Oh, they scream, okay? It's very painful. Increased risk in new mothers, look at that. Okay, because you hold it. That's why we train patients in the hospital. Best way to hold a baby is here, this way. So you put the baby's head here so it doesn't cause that, okay? That's the idea. Golfers, there's other players, but that's Dequarian tenosynovitis. I know you guys will remember everything. The day of the exam, you cannot forget this name of the tendon. Okay? Very careful, folks. Because there is an extensor pollicis longus muscle too. So careful when you pick up the options. Okay, I repeat that. So that's Dequarian tenosynovitis. Any question for me? Next, limb compartment syndrome, one of the surgical emergency. Limb compartment syndrome can only happen in upper extremity or lower extremity, okay? It cannot happen anywhere else. Why? If you remember the forearm muscles, there's about 27 muscles in your forearm, okay? That 27 muscle is divided into compartment, first layer, second layer, third and fourth. There's about 4 compartments, right? What do we call by compartment? In between muscle, there is some little space. It's very tight, but there's a space. That's why we make the muscles into compartment. Is everybody clear, folks? So it's like a group of muscle have a connective tissue, wrap it. Another group of muscle, wrap it. In between that, there's a space. Now, sometime what happened, due to whatever problem, increased pressure within fascial compartment of the limb. So let me show first picture of the compartment. Let's learn that. Now, this is